hard to find answers to questions when you're a nursing student or a nurse. So this is basically why we set up this website, so we could help fellow nurses. We offer on our website are consents DVDs with test questions that will help you pass nursing classes in the state boards. They're written by 2 clinical and academic nurses with over 40 years of nursing, 12 years of academic teaching, and 8 years of tutoring students who have flunked the state boards with a high success rate. 2 published books that will help not only students but new nurses and nurses interested in becoming nursing instructors. Other services provided on our website are providing answers to questions, online tutoring, which is available at reasonable prices. There is an ongoing development of time-tested educational tools and new DVDs that will concisely explain medical diseases and treatments. We are also going to post a newsletter. Now, the following slides that you see will be indicative of some of the things that are included on our DVDs. Let's try our products to help with your success. You can avoid paying large amounts of money for the same information, and we will provide feedback to your concerns. Output depends on the heart rate and how much blood is pumped out with each beat, or called the stroke volume. For example, if the patient is anemic, the body will try to compensate by increasing the heart rate to perfuse all the organs. If the client has had cardiac decompensation, such as congestive heart failure, the heart will not be able to pump, which means that they have decreased cardiac output. This in turn will cause volume overload, resulting in distended neck veins, liver enlargement, and peripheral edema, which is right-sided heart failure, and can also cause left-sided heart failure, which is pulmonary edema. Age is one. As we get older, our baroreceptors, which help monitor and maintain our blood pressure, become less sensitive with aging. So that's why older adults are more prone to experience low blood pressure. You have your stress that produces cortisol. Cortisol is an adrenal hormone that helps to regulate blood pressure and the immune system during a crisis. But chronic stress can cause changes in the blood pressure, sleep, and weight. Ethnicity. Certain races are more prone to hypertension due to genetics, such as African Americans. With males, gender are more prone to hypertension because of testosterone levels. And once women pass menopause, they tend to then become more sensitive to hypertension. Cardiac meds are meds that will control the blood pressure, such as your beta blockers and ACE inhibitors. Any activity in weight. Smoking will damage the inner lining of the arteries and cause stiffness and inflammation, thereby affecting blood pressure. And then you also have the disease process, which also affects the blood pressure, such as kidney failure, alcohol consumption, etc. Thyroid gland controls a person's metabolism, growth and development, and body temperature. It's a butterfly organ located in the front of the neck. It has 2 lobes that cannot be felt if the thyroid gland is of normal size. It secretes thyroid hormones, T3 and T4, and calcitonin, that has to do with calcium metabolism. Iodine is necessary for the production of T3 and T4. The thyroid gland is affected by the thyroid stimulating hormone, TSH, which is produced by the pituitary, and it stimulates the thyroid to produce T3, T4. We're going to look at diabetes insipidus. Diabetes insipidus is not enough antidiuretic hormone. Central diabetes insipidus is caused by deficiency of vasopressin, or neurophrenic diabetes insipidus is caused by a defect in the kidneys that will not let them respond to the antidiuretic hormone and reabsorb water back into the system. Causes, it's caused by damage to the hypothalamus or pituitary gland as a result of head injury, infection, surgery, or tumor.
Signs and symptoms are excessive urine loss up to 6 liters a day, hypernatremia because you become dehydrated, low urine specific gravity, urine osmolarity is low, plasma osmolarity is high. And these are all signs that you're dehydrated inside, but your urine that you pass out is extremely diluted. So your treatment is to replace fluids and administer vasopressin, which is the antidiuretic hormone. Looking at ABGs, you want to look at the pH. The pH is the abbreviation used to denote the alkaline or acidic levels of a substance. When interpreting an arterial blood gas, the pH is the guiding factor. The normal range of the pH is 7.35 to 7.45. A pH of less than 7.35 means the blood is more acidotic. A pH of greater than 7.45 means that the blood is more alkaline, also called basic.
CO2 is the abbreviation for carbon dioxide. Remember, carbon dioxide is a gas, and the body uses the lungs for exchanging carbon dioxide and oxygen. When you see carbon dioxide or CO2, think lungs.
So all our information has been copyrighted and protected by law. Our return policy is a DVT returned within 10 business days of purchase will be reimbursed at full price minus the $2 processing fee. Download sales are final. Customers are encouraged to contact us at our website for any questions, concerns, or complaints.